Hafidads and Mananasid Zeus, many of God's blessings to all of you here this morning. And a special happy birthday to Minority Leader, Senator Tello. Happy birthday and God bless you. The Committee on Public Accountability would like to call this information briefing to order. The time is now 9:04 a.m. and it's Thursday, May 14th, 2020. And for the record, and in accordance with 5 GCA Chapter 8, Section 8107, public hearing notices were sent on Thursday, May 7th, 2020, adhering to the 5-day notice, and a second public notice on Tuesday, May 12th, 2020, adhering to the 48-hour prior notice. In addition, this hearing was noticed on the legislature's website at www.guamlegislature.org, and written testimonies may be submitted by emailing speaker@guamlegislature.org, or you may hand deliver to our office at 163 Chalan Santo Papa, Hagatnya, Guam 96910. I'd like to recognize my colleagues who are here with me this morning in no particularly order. I see Oversight Chair, Committee on Rules, Chair Senator Regine Biscoli, good morning. OFB Oversight Chair, Senator Joe San Augustine. My Vice Chair, Senator Kelly Marsh Taitano. I also have Minority Leader Senator Tello Taitagui, Senator Jose Pito Terlahi, Senator Jim Moylan, Senator Will Castro, Senator Luis Muña, and I know the rest of my colleagues will be joining us. If I missed you, please just let me know. Manana Sidzuas. Colleagues and to the listening audience, I want to say thank you for being here. Also to the acting Chief of Staff to the Governor, John Minjola Cabo Jr. Good morning. Thank you for being us, and to the team, to all the directors, thank you for being here. Over the last few weeks, the government of Guam has been in a state of emergency. Our government, as well as our people of Guam, have been dedicated as we respond to COVID-19 as a community. Today, we enter the third month of the state of emergency, and looking at the original projections and the numbers today. To all of you here today, to the many COVID heroes on the front lines and behind the scenes, to all our people of Guam, I want to start off by saying, Undangkulu Nasidus Masi, for coming together as one team Guam. This journey wasn't easy, and I think we can safely say that there is not a single person on this island that did not sacrifice something which contributed to this success. Our school children sacrificed their time with friends. Mom and dad sacrificed their sanity, and as they stayed home and learned firsthand the commitment of all our teachers. The doctors and nurses, the countless first responders and frontliners sacrificed their safety and livelihoods to serve our community. I know people that lost their jobs because everyone else was staying home. I know individuals who have not been able to see their husbands, their wives, their nanas, their tatas, their ninas, their ninos, their children and grandchildren as they stayed home doing their part to stop the spread. It is because of the teamwork amongst all of us that we can now broach the topic of recovery and return to normalcy. This day could not have come any sooner, but before we begin talking about that, for me personally, I want the opportunity to have a better understanding of what exactly happened over the last 8 weeks. And as Oversight Chair of Public Accountability, I want to share that based on all the questions and concerns from the community, I had compiled a list of questions and asked the governor to have her team do a presentation here this morning. Over the last 48 hours, the legislature has received pertinent documents that address these questions that have come up in the last few weeks. And I am grateful that my colleagues and I, as well as the people of Guam, can now get a better understanding of the actions of our government. And for the record, I would like to read the questions that have been transmitted. The Government of Guam response plan to combat COVID-19, a timeline of steps taken by Gov Guam to respond to COVID-19, an understanding of the logic, rationale, and steps behind the procurement of quarantine and isolation facilities and costs associated with each and all facilities, standard operating procedures, staffing, and duties of detailed personnel for quarantine facilities and isolation facilities. The 117.9 million budget from the funds allocated to Guam from the CARES Act. How were these numbers derived? How were requests from agencies prioritized? And the status of the updated Guam pandemic plan. The Government of Guam recovery plan from COVID-19, process behind the creation of the tiered P Core approach, the 20 million small business relief program as outlined in the budget submitted for the CARES Act fund, the scope of work and plan of action for GIDA's economic impact study as outlined in the budget submitted for the CARES Act fund, and the plan of action for the Government of Guam in response to revenue reductions. I had also received, colleagues from the White House, a document outlining their support of our people of Guam. Colleagues, these documents outline over 785,836,000 that has been allocated or awarded to Guam in response to COVID-19. And as such, colleagues, I have also included the following items for them to present status updates to the 35th Guam Legislature. Support received from the Trump administration in response to COVID-19. The 10.1 million that has been obligated to by FEMA as of April 27, 2020. The 736,000 in CARES Act funding that has been awarded to the Guam Department of Administration. The status of the municipal liquidity facility lending program to ensure funding for essential services. The 2.6 million in COVID-19 funding through HUD. The 12 million from the U.S. Department of Interior grants. These require you to apply for grants, and it seems that the administration has applied for this DOI grant and they've applied for it and they've been awarded the funds. So the clarification of what these funds will be used for. The 1.5 in dislocated worker grants to Guam, the 1.5 million in dislocated worker grants to Guam. The 3 billion from USDA that can be used to purchase fresh produce, dairy and meat products. I want to also share with you that the 2.7 million in Federal Transit Administration funds to help public transportation here on Guam. I also want to include on that the Department of Veteran Affairs. The Department of Veteran Affairs provides services based on the request by the states and territories. Has this request been made already? And the 2.9 million in funds through the U.S. Department of Justice for Guam. Colleagues, I have been working closely with our federal counterparts, and I would like to thank them for their support, and I asked them if they would be willing to present, and unfortunately, due to their scheduling conflicts, we couldn't make that happen. But the assistant to the president and the director of the Office of Intergovernmental Affairs, Mr. Doug Hosier, who also hosted our briefing call this morning at 3 o'clock, said their team will not be able to join, unfortunately, as they have 2 governor meetings with the president, must be going on today. The Assistant Secretary of Interior, Mr. Doug Dominich, shared some remarks that I would like to read to all of you guys now. Dear Speaker Tina, unfortunately, it would be difficult for me to participate as well. As you may know, most of the federal buildings are closed down and employees are working from home. Ordinarily, we would be honored to support you and the legislature and the governor as we work together through this terrible virus. As you are aware, in response to this challenge, President Trump immediately mobilized 42 separate federal agencies within 3 days of the governor's request. The president approved Guam's emergency declaration. He signed 3 significant bills passed by Congress, resulting in remarkable funding for Guam, including over $117 million in the Coronavirus Relief Fund, $54 million from the Department of Education to assist schools and children, over $12 million in technical assistance from my office, and additional through other agencies, especially to support hospitals and healthcare workers, and much more. That said, we are mostly concerned about the human cost of this tragedy. Our hearts go out to the families of the casualties of this disease on island, and we thank the hardworking care workers who are dealing with the 130 plus cases of COVID on the island. And also he noted about the deaths with the 5 from Guam and the 1 sailor. Finally, our thanks go out to the people of Guam for reaching out to help the sailors from the USS Theodore Roosevelt. This was an especially difficult thing to do, and your assistance will be remembered for a long time. We can win this fight if we fight together. Blessings, Doug Dominich, Assistant Secretary. Colleagues, I want to also say that I personally met with Rear Admiral Manoni yesterday afternoon, and he also repeatedly shared his thanks and appreciation to the people of Guam for our spirit of Inafamalik with regards to the USS Theodore Roosevelt. And he also mentioned that the commander of the United States Pacific Fleet, Admiral John Aquilino, has asked him to deliver his sincere appreciation to our community for stepping up to the plate for the Theodore Roosevelt. And during times like these, it truly takes partnership and teamwork to get the job done. And all of you who are here today, my colleagues in the administration, thank you for coming to the table. As with all other information briefings held in this committee, whether it be a dozen of Government of Guam agency directors to talk about the Guam buildup, Joint Region Marianas, or the insurance provider for the Government of Guam, all stakeholders are called to the table in one sincere attempt to get information that will be beneficial to our entire community of Guam. Given that, I assume this will be an ongoing topic of discussion, and I am sure that this will be one of many, many opportunities for our 2 branches to come together and collaborate on a path forward. As with all information briefings, colleagues, I ask that all my colleagues here today submit any questions you may have after this presentation in writing to my office. And once we compile all the questions, I will transmit them to Mr. John Calvo Jr. and the administration will respond to this August body in writing. I have seen in the past, some of you may think that this is a deliberate plot to not be transparent, but let me be the first to point out that one of our colleagues here today, based on a previous informational briefing I hosted with the same format, submitted a grand total of 66 questions to the panel, and her questions with the answers have been transmitted to my office and has been posted on our website for months for anyone to access. And also for the record, the reason this is set up this way is to ensure that given the vast array of topics that will be discussed and the need for subject matter experts and my desire to facilitate getting you all the answers to any and all the questions that you may have, this is the most efficient and effective way to hold an informational briefing. I have taken it upon myself to organize this, and my goal is to get answers, to get you the answers, the people of Guam, the answers that they want to hear, and I want to commit to that and making sure that we as a community, we as the 35th Guam legislature and the administration, of course, is transparent to our people. And to the listening audience at home, as I mentioned earlier, my good colleague, and I must give her recognition for this, Senator Lee beat me with her 66 questions. I submitted 21 questions today, so please help me out and send your questions to my office. You can do so by emailing speaker@guamlegislature.org or call my office at 477-2520 or even via the Facebook and Instagram social media platforms. I say this because I'm sure that there are some young adults out there listening to this, and this is your government also, this is your future, and Titino wants to hear from you as well. So John, I want to let you know that I have a few follow-up questions that I will be transmitting based on the briefing call I had this morning with the White House. They mentioned, so that I can share with you, the Economic Development Authority under the U.S. Department of Commerce may have some programs that we can take advantage of with regards to the Guam Visitors Bureau. And I hope sometime soon, along with our tourism oversight chair, the good senator from Jonia, Senator Therese Salahi, that we can sit and talk about this with the Guam Visitors Authority Board. And I want to share with you, colleagues, that I've invited, of course, the acting chief of staff, Mr. Ed Burns, director of DOA, Lester Carson from BBMR director, David Deosola, thank you for being early, Daphne Shimizu from Director of Revenue and Taxation, Dr. Ricky Hernandez, the GITA Deputy Administrator, Director of Policy, Mr. Carlo Branch, and I understand the Guam State Clearinghouse Director is also in the house, Stephanie Flores, and to all of you here this morning, Undakal Sidus Masi for coming. And I'm now going to turn the floor to the Acting Chief of Staff, Mr. John Calvo, and I want to thank my colleagues. I know that was a long introduction, but I wanted to include in the briefing this morning the information I got from the White House briefing and the topics that I just shared with you so that we can get going with the administration. So John, I turn the floor over to you, Mananasi Joas.
Thank you, Madam Speaker and Mananasi Joas. For the record, I have on our side, we have the the Deputy Administrator for the Guam Economic Development Authority, Dr. Ricky Hernandez, the Director of DOA, Mr. Ed Byrne, also the Director of BBMR, Mr. Lester Carlson, and the Director of the Department of Revenue and Taxation, Ms. Daphne Shimizu. Operating our quarantine facility is Ms. Rebecca Respicio, and the Director of the Guam State Clearinghouse, Ms. Stephanie Flores. Thank you again for the opportunity, and hafide and good morning, Madam Speaker and members of Imenay 35 na Legislatura in Guahan. On March 15, the island woke up to the news of our first COVID positive cases. That same day, Italy reported a total of 24,747 confirmed cases, and their death toll rose 25% to 1,809. Deaths in Spain more than doubled in a day to 288, with the number of the infections near 8,000. New York had over 700 cases with 3 deaths. There were a total of 1,224 confirmed cases in California. Governor Newsom told state media that he had projected that 25.5 million Californians will be infected with the virus. Closer to home and our tourism source markets, South Korea reported 8,162 confirmed cases, with a total of 75 deaths. COVID-19 infections in Japan increased by 30 to 803. That was the world on March 15, just 2 months ago when we confirmed our first cases, and that could have been Guam's reality. While each of these numbers is disturbing in their own right, statistics can be cold and often easy to ignore. In Spain, soldiers helping to fight the coronavirus pandemic found elderly patients in retirement homes abandoned, and in some cases, dead in their beds. In New York, funeral homes have been overwhelmed by the number of bodies due to COVID-19, and some have had to resort to storing them in U-Haul trucks. On March 23rd, the World Health Organization declared that the global COVID-19 pandemic was accelerating. Based on the data we had at that time, the initial model for Guam's COVID-19 cases projected a mass fatality of 3,000 people. By all accounts, we had a small window of opportunity to prevent that from happening. Knowing that our first cases were recent travels to the Philippines and that President Duterte issued an order on March 17 that effectively gave visitors to the Philippines just 3 days to vacate the country, we had to act quickly. Invoking her authority under the Public Health Emergency Act, Title 10, Chapter 19, Governor Leon Guerrero used her emergency purchasing power to obtain quarantine and isolation facilities. This was necessary to contain the virus and prevent the collapse of our healthcare system. Contrary to popular belief, this was necessary because the governor of Guam did not and does not have the legal authority to close down an FAA facility like the Guam International Airport Authority. While this is knowledge we understood early, on April 3rd, Governor Ige of Hawaii told state media that the FAA would not close down the federal airspace. From the outset, the governor spoke often of flattening the curve. Flattening the curve is not solely about reducing the number of infected cases. According to the experts in a pandemic, we must accept that some people will get infected. But infection alone is not the greatest danger. As COVID-19 has so clearly demonstrated, the danger comes from more people needing acute treatment than healthcare systems can handle. Put simply, if a hospital has 15 intensive care unit beds, but over 2,000 people are infected with COVID-19, and just 10% of them needed treatment in that hospital's intensive care unit, those 20 patients would need intensive care, but only 15 people would be able to avail. The longer the shortage persists, the greater the likelihood that the acute healthcare system collapses for all. No more ICU beds for COVID-19 patients, for stroke patients, for those suffering a heart attack or brain trauma from a major accident. COVID-19 overwhelms the system and people die. Every step we have taken, every course of action has been done with that in mind. Because of the nature of this virus, Governor Leon Guerrero assembled her physicians advisory group to offer advice relative to the appropriate medical response to the COVID-19 pandemic. We knew the importance of having scientific evidence and sound medical advice whenever we decided to implement a protective measure or lift restrictions. As part of all our efforts, all of the agencies worked with federal partners to ensure we received the supplies we needed in this battle. We began fit testing our first responders early on, and we made sure they never ran out of personal protective equipment and that all of our patients would have access to ventilators. Not once during this pandemic have we run out of those items. As we have learned from other countries, testing is a key component to beating this virus. We worked and continue to work with the CDC, HHS, and the World Health Organization to maintain a steady supply of test kits. But test kits do not necessarily stop the spread of the virus. Jurisdictions have many tests, but they do not have the results. Knowing this, we focused our efforts on targeting community-based testing aimed at our most vulnerable populations. The data has shown that all of our efforts have helped contain the spread. Knowing that the medical side was just half the battle, we took the appropriate steps to increase our law enforcement. We worked with the judiciary and all the agencies with public safety officers to expand law enforcement presence on our island. We also mobilized the Guam National Guard so they could offer support to public health and GPD to protect our community. The ultimate goal is to protect our hospitals and reduce the number of cases that require acute care. We must not forget that at the beginning of April, Guam had 20 COVID patients in the hospital, and that was already placing a strain on our healthcare system. When a crisis begins to clear, it is human nature to look back and judge the steps we have taken. In a free and open society, this is absolutely necessary. We accept that it is the legislature's role, and we respect that. We simply point out that exceptional emergencies require exceptional tools to deal with them. The governor did not invent these tools. They were given to her and every other governor who may face the same circumstances. This was the wisdom of your legislative predecessors. They understood that in a true public health emergency, traditional procurement or even emergency procurement may not be enough. As such, the Organic Act and the Public Health Emergency Act permitted the governor to move swiftly, save lives, and protect Guam. So far, COVID-19 has cost thousands of people their livelihoods, and it has cost 5 people their lives. We believe that any unbiased, independent third party will look at what we have done and realize that without the governor's strong leadership within the confines of law, Guam may have paid an even greater price. At the direction of the governor, I have assembled our department and agency heads to present on the various steps our administration has taken to prepare for, respond to, and control the spread of COVID-19. As we have stated time and time again, this is an unprecedented time in our history. However, I am confident that while we may not always agree on everything we have done, we can agree that our whole of government approach has positioned us for a stronger tomorrow, because in everything we have done together. And Madam Speaker and members of the Guam Legislature, today we take this opportunity to present on the subject matters that the Speaker has requested. And again, I want to acknowledge our directors and agency heads who are present, both online and here at the Governor's office, to be with you this morning. And so I believe the slides will be on the screen.
Thank you, John. And before you proceed, I just want to acknowledge the presence of our Vice Speaker, Senator Talina, and Majority Leader Senator Talina Nelson, our Legislative Secretary, Senator Amanda Shelton, Senator Therese Terlahi, and also I see Senator Mary Torres. I want to thank all my colleagues who are here again this morning. Please proceed, John. Thank you.
Thank you, Madam Speaker. As you can see on this slide, we'll begin with our title page, which is, of course, the Government of Guam's COVID-19 response in our presentation today to the Guam Legislature. The first topic is our timeline of events. On January 29, Public Health met with key agencies to discuss emergency protocols in the event a patient tests positive. Public Health and CDC begins regular meetings with healthcare providers to educate our community on the signs and the symptoms. On January 31st, Public Health and CDC briefed island leaders at the Homeland Security. The health alert cards were issued to the Guam International Airport, and we've done this in order to accommodate our passengers in different languages. On February 3rd, we did a video infographic, PSA, for our community to begin educating them on the COVID-19 virus. February 4th, the Guam Hotel Restaurant Association met with membership at the Guam Outrigger, which included, of course, the relative health agencies, as well as other panel members who were instrumental in being able to educate our community on the COVID-19 virus. February 5th, Public Health, the airport, and the Governor, Lieutenant Governor began an educational campaign again on the education of the COVID-19 virus. On February 7th, the Governor of Guam denied the entry request by the MS Westerdam. On the 17th, the Governor denied the request for the Hong Kong men's basketball national team to play under the FIBA League at the University of Guam. On February 18th, the GVB briefing for all GVB membership at the Lotte Hotel, again with our related health agencies, with the Guam International Airport, Customs, and the Guam Hotel Restaurant Association. On the 21st, the Guam International Airport began to procure thermal scanners to begin health checks for our passengers arriving and departing the airport. On the 26th, the Guam Department of Education prohibited any school-sponsored student or employee travel to any country with confirmed cases of COVID-19 outside of the United States. On the 27th, the governor met with Rear Admiral John Manoni to discuss prevention and response planning efforts as a whole of government approach. On March 3rd, the governor spoke with Vice President Pence via teleconference, which was the first of weekly meetings. The Department of Public Health and Social Services simultaneously began their pandemic plan review work session day 1 at the Pacific Star Hotel, which was, of course, just with the public health staff. On the March 4th, Public Health Pandemic Plan Review continued with the session day 2 at the Pacific Star with all stakeholders. And then on the 5th, the Pandemic Plan Review continued with work session day 3, where a tabletop exercise was also conducted, and the governor was able to address the Guam Medical Association on the government's COVID-19 response. On March 9, the governor met with business leaders to discuss the proposed economic mitigation plans, the temporary economic assistance and mitigation team, and the Guam plan was unveiled. In that plan, the 5-point plan was to assist individuals, families, and businesses on Guam impacted by the global effects of COVID-19. Some of those included the postponed payment of 40% of BPT due for a 90-day period. It covered the 100% of credit card fees assessed by the government of Guam. It offered small business loans with deferred payments, rebate a percentage of airline landing and apron fees, and requested for utility payment plans. On March 10th, the Department of Public Health lab received CDC test kits. Validation process began. And on March 11th, the certified nurse aides received training on thermal scanners to be deployed at the Guam International Airport. A GFD town hall was held for our frontline and first responders with Dr. Jolene Uggan of the Guam Memorial Hospital, the Department of Public Health and Social Services, as well as the Advisory Council approved the PUI criteria. On March 12th, the airport was equipped with 4 thermal scanners. Another GFD town hall was held with Dr. Jolene Uggan, the Department of Public Health. The Guam National Guard provided decon training to medical staff. And the Department of Public Health Professional Licensing Office also disseminated physicians alert. And that same day, the governor met with clinicians, healthcare providers to discuss protocol supply. And later on that day, the governor met with the Mayor's Council of Guam to provide an update on the government's COVID-19 response. On March 13, the governor's circular number 2020-08 was issued, and it was an advisory on government travel and leave, and the airport began screening passengers for temperatures. On March 14th, the governor issued Executive Order 2020-03, which declared a state of emergency for Guam. On March 15, the first 3 cases of COVID-19 in the territory were confirmed. All village-sponsored events and activities were suspended. Public senior centers were closed on March 18th. Or we gave the information that public senior centers would be closed on March 18th, a couple of days later. The Guam Memorial Hospital restricted its emergency department to staff and patients only, and GMHA changed the visitor policy and mandated temperature screenings for employees. On March 16th, the governor issued Executive Order 2020-04. Public schools were closed. Prohibition on gatherings of 50 or more people in a single room or space at the same time for certain activities. There was a limitation on the occupancy of any place of business or public accommodation for which attendance is anticipated to be fewer than 50 people, and it shall operate at no greater than 50% of occupancy and no greater than 50% of seating capacity. Arriving travelers from areas affected by COVID-19 were subject to mandatory quarantine. The mandatory 14-day quarantine for all passengers arriving from the Philippines in a government facility, a mandatory 14-day quarantine for all non-resident passengers arriving from COVID-19 affected areas in a government facility, and a mandatory 14-day self-quarantine for all returning residents from COVID-19 affected areas. On March 20th, the governor issued Executive Order 2020-05. All non-essential businesses and gatherings were mandated to cease operations. The following day, she issued Executive Order 2020-06, which was the creation of the COVID-19 Unified Response Effort, also known as the Cure Action Team, and the direct use of healthcare facilities to provide any and all services necessary to respond to the COVID-19 pandemic. The executive order also extended the suspension of non-essential GovGuam offices by an additional 14 days, lasting until April 13, 2020. Any space that encourages social congregation or gatherings were closed. Suspension of certain provisions of the open government law was also covered in that executive order, as well as all public and private schools for educational purposes remain closed through April 13, 2020. All GovGuam public parks and beaches will be closed except for individual use and exercise. On March 28, the governor issued Executive Order 2020-07, which extended the closure of non-essential businesses and facilities to April 13. It established a moratorium on evictions and clarified price gouging prohibitions. It allowed for the telephonic participation in public meetings. On March 30th, there was a mandatory 14-day quarantine in the government facility for all passengers arriving on Guam. On April 5th, the governor issued Executive Order 2020-08 and 2020-09. The public health emergency under those executive orders was extended until May 5th. It created the COVID-19 response pay differential policy where government workers, based on their potential exposure to the virus, the maximum of an additional 25% was reserved for law enforcement, healthcare providers, and others with direct contact with likely infected members of the public, and required the use of face masks in any essential business. On April 10, the governor issued Executive Order 2020-10, which established the road closure traffic flow plan to limit the use of roadways to essential functions and activities. On April 25th, we began the COVID-19 pilot project for vulnerable populations. On April 30th, the governor issued Executive Order 2020-11, which extended the public health emergency to May 30th. And it established the pandemic condition of readiness, also known as the PCOR system, for the gradual reopening of Guam's economy. On May 5th, Executive Order 2020-12 and 2020-13 was issued. 2020-12 established the Programan Salapi Adjudanitauta, a direct disaster aid program that will be paid for with the coronavirus relief funds authorized under the CARES Act. This local program supplements and is in addition to the economic impact payment. Executive Order 2020-13 established the COVID-19 Pandemic Recovery Office. The executive branch line agencies will also be required to publish their responses to requests for documents under the Sunshine Reform Act of 1999. And the administration will also submit reports of expenditures for goods and services in response to and a directed recovery from the COVID-19 pandemic. And this public health emergency to the legislature and posted on the website of the Office of the Governor. Procurement for an independent third party will begin. On May 8th, Executive Order 2020-14 was issued, and it declared pandemic condition of readiness 2, effective on May 10, 2020 at 8 a.m. All businesses are able to operate by implementing measures as outlined in the document, which was the minimum pandemic workplace operational requirements as issued by the Department of Public Health and Social Services. Social gatherings or congregations were limited to no more than 10 people. All government of Guam parks and beaches continue to be closed to all activities except for individual use. All businesses that were allowed to operate during P Core 1 may continue to operate. Other businesses now allowed to operate shall be limited to those listed in Public Health Guidance Memo 2020-07 and any and all future published guidances. Business who are allowed to operate will no longer be restricted to selling only essential items. Any place of business or public accommodation shall operate at no greater than 50% of occupancy. And the government of Guam continues to operate in a limited capacity, regardless of operational status of an agency or department. All government of Guam employees remain on regular status and are expected to report for duty within 2 hours from receiving notice from his or her supervisor. And so that was the timeline for the events regarding the executive orders and all the government of Guam's response to COVID-19. In our next slide presentation, we will have the quarantine and isolation facilities. But as part of that, as part of this slide, the government of Guam, as we know, both in our reports and also in the executive orders that we covered, the government of Guam identified certain sites to be used as quarantine and isolation facilities. And we want to again emphasize that the governor was able to utilize her emergency power under the Public Health Emergency Act, of course, 10 GCA, subsection 19403. And for the record, I'd like to read that in these emergency powers during a state of public health emergency, Imagalahan Guahan, in this case, the governor of Guam, may, one, through an executive order, suspend the provisions of any regulatory statute prescribing procedures for conducting local business or the orders, rules, and regulations of any government of Guam agency, to the extent that strict compliance with the same would prevent, hinder, or delay necessary action, including emergency purchases by the public health authority to respond to the public health emergency or increase the health threat to the population. As I covered in my opening remarks, the use of these the governor's decision to begin to use and select quarantine facilities as well as isolation facilities was also in response to the influx of passengers arriving as a result of President Duterte's ordered that those individuals return to their home countries within 3 days of March 17.
Thank you,
At this
John.
time, I'd like to, go ahead, Madam Speaker.
Yes, at this time, I know that you guys want to do a presentation, so I'm going to just give me a moment. I won't take a recess. I'm just hoping that the MIS team here has uploaded what you've provided. So just give us a moment to set that up. And I guess that's where we will proceed, right, with the presentation.
Sure, no problem.
John,
Madam Speaker,
I guess you can proceed.
thank you. At this time, Madam Speaker, I'd like Rebecca Respicio will discuss the SOP staffing and duties at our quarantine and isolation sites.
Good morning, Speaker and Senators. I'm happy to be here to talk about the quarantine facilities. Quarantine is used to keep someone who might have been exposed to COVID-19 away from others. Someone in self-quarantine stays separate from others, and they limit movement outside of their home or current place. A person may have been exposed to the virus without knowing it, for example, through traveling or being out in the community, or they could have the virus without feeling symptoms. Quarantine helps limit further spread of COVID-19. The mandatory quarantine is applied unless the traveler possesses either a health care recognized and certified document that attests he or she is not infected with COVID-19 within the last 72 hours, or a secure COVID-19 test within 72 hours prior to arrival on Guam, and present negative results for entry into Guam. Any and all travelers arriving within these credentials will be subject, without these credentials, will be subject to mandatory quarantine. So on the screen, you can see a basic flow chart of what our management of persons in quarantine facilities, and every time I say QFAC, that will refer to our quarantine facilities. So basically it starts out with a person travels into Guam, is screened at the airport, and if they meet the criteria they have to meet the criteria to be quarantined at our QFAC. And again, the criteria basically means that they didn't present the necessary COVID negative test. Passenger is then transported from the airport to the quarantine facility. The passenger is checked into a room at the QFAC for 14 days. Passenger receives 3 meals, breakfast, lunch, and dinner daily. Medical staff conduct health screening with passengers twice daily. So does the passenger experience any COVID-19 symptoms? If the answer is yes, the passenger is tested for COVID-19. If they do have a positive result, the passenger is transferred to the isolation facility for medical treatment. If they have a negative result, the passenger remains at the QFAC and will continue to be monitored by medical staff. Passenger may be retested. If retest result is negative, passenger will be released on the 14th day. Now, if the passenger does not experience any COVID-19 symptoms, then the passenger basically completes quarantine and is released from the QFAC on the 14th day. There's other services that we do provide at the QFAC, and so does the passenger possess any mental health concerns? If the answer is yes, the passenger will receive counseling from behavioral health workers. Whether or not the passenger exhibits any mental health concerns, they still will be released from the QFAC within the 14 days or after the 14 day. Does the passenger have any existing medical issues? If the answer is yes, the medical staff will conduct health assessments on the passenger. Depending on the medical condition, medical staff will make recommendation to either transfer passenger to the hospital or have he or she self-quarantine at home, and I'll explain that process a little bit later. Public health will follow up with the passenger until 14-day period is completed if they are self-quarantining at home. If the passenger does not have any existing medical issues, then the passenger still completes the quarantine and is released from the QFAC on the 14th day. So that basically is just a basic flow chart of the QFAC management of a person in our facility. The period of quarantine, the quarantine period for COVID-19 exposure is 14 days from the time the passenger's arrival date into the island. If the passenger remains well during the period of quarantine, they will be released on the 14th day. Alternatives may be considered on a case-by-case basis, where travelers may complete part of their quarantine at home after a health assessment and or negative testing and approval from the Department of Public Health and Social Services. Persons in quarantine will be monitored regularly. Those who develop symptoms will meet the person under investigation criteria. They will be tested and managed appropriately. People who test positives will be transferred to the hospital or isolation facility immediately. Operation of the quarantine facility is a 24-hour facility operated by the government of Guam. The original sites that were identified as a quarantine facility included the Guam Wyndham Hotel, Days Inn, and Santa Fe Hotel. However, on March 23rd, 2020, passengers from Santa Fe Hotel in Dazen were transferred to the Pacific Star Hotel. And on April 7, 2020, passengers from Wyndham Hotel were moved to the Pacific Star Hotel. The Pacific Star Hotel is the current quarantine facility. Passengers are not allowed to leave their room at any time. If passengers have any concerns, they must contact front desk. They will receive three meals daily. We do have a schedule for all those meals, and our goal is to remain on time for the breakfast, lunch, and dinner service. Passengers are allowed to receive items from friends and family on the outside. These items include, but are not limited to, food, drinks, clothing, blankets, hygiene products, etc. Delivery of these items are accepted daily within the hours of 10 a.m. to 12 p.m. and 7 p.m. to 9 p.m. Meals and dropped-off items will be delivered by the QFAC staff. All individuals entering the QFAC must be cleared by security. Only QFAC personnel, designated public health and medical workers, hotel staff, and security are authorized in the QFAC facility. Unauthorized persons are prohibited to enter the facility. Now I'm going to talk about the quarantine personnel and our duties and responsibilities. So as you're aware, I am the QFAC coordinator. And so the QFAC coordinator is the overall lead person responsible for managing the activities at the QFAC. The coordinator's duties include, but are not limited to, managing the command center. This is where we handle all the incoming and outgoing phone calls, as well as all the other logistics associated with our QFAC. Address passenger requests for room needs, communicate with outside security regarding all movement, arrange transport for passengers, appointments, and transfers, as well as transiting passengers back to the airport, coordinate military releases upon command verification, work with various ship vessel agents for quarantined crew members, communicate passenger needs with other on-site professional staff from the Healthcare Services of Pacific lead nurse, our Public Health and Social Services CDC team, the assigned social workers, and our mental health lead, for which we do have Major Tom Babauta with the Guard, who is also a mental health professional. Part of our responsibilities also include that I answer all questions regarding the quarantine facility process or direct questions to the proper authority, direct staff for the deliveries and needs to the rooms, arrange room changes, arrange meals for new passengers upon arrival, arrange for translators for non-English speaking passengers, receive travel confirmations and verifications as needed, prepare and finalize end of day summary report, which needs to get out to, which is the complete data and counts, which is sent to the medical team, public health, the Guam Homeland Security, the governor's office, and all concerned. Communicate any additional needs with the hotel manager and all other duties that basically require action. Then we have an administrative post. That staff is responsible for accountability of all passenger counts, updating all listings and making sure they are accurate, the tracking of all 14-day auto releases. So when I use the term auto release, it's just our term at the QFAC. That means they've completed their cycle. Meal tags on all occupied rooms, meal charts for meal distribution, meal lists to the chef with accurate special diets and allergies as identified by all passengers. We track room issues for maintenance reporting, daily list of dirty rooms ready to be cleaned based on the CDC guidelines, maintain records of transfers, military releases, hospitalizations, appointments, etc., and records of incoming and outgoing passengers. Then we have our quarantine service personnel, and they're responsible for the following tasks. They deliver the meals, the breakfast, lunch, and dinner to all passengers in the rooms, conduct meal counts to ensure the chef prepared required order, separate and account for all floors based on passengers per floor. They ensure all dietary and allergy meals for specified rooms are accurate. They address passenger calls about any meal concerns, comments, additional water requests. They disinfect everything along the way. They deliver all incoming items from the outside to every single room that it is labeled to be delivered to. They address passenger calls, passenger needs about any pending deliveries, any other issues that needs to be brought to the QFAC coordinator's attention. And they basically assist with everything and anything that needs to be done on the daily. We do have two staff that are located at the airport. They are part of our QFAC team, but they are there at the airport because they have to be present at all incoming flights. And what they do at the airport during the incoming flights is they basically, after the airport team identifies who is going to the QFAC facility, these passengers will go to our staff, and staff will screen them and find out how many passengers need to come, what are the room accommodations that may be needed. They also screen for any important and vital medical conditions that need to be addressed immediately. And they will also make us aware of any dietary needs, to include allergies, to make sure that all passengers remain safe, even with our meal service. And then, of course, we do have present at our QFAC the regular hotel staff that is employed by the Pacific Star. And their responsibilities are fielding in-room calls and outside calls for transfer to us. They provide the connections to the chef, engineering, housekeeping, the manager as needed by us. They also provide front desk items like the tissue, the towels, blankets, coffee pods, or whatever, an extra fan for the room, whatever is needed. However, they do not go to the floors at all. They have zero contact with the passengers. Everything that we request for them, we bring to the passengers. That said, just some procedures that exist in our QFAC. We have safety measures. The QFAC, because it's a 24-hour facility, unauthorized individuals, as I said earlier, are prohibited from entering the facility. Law enforcement officers from the Guam Police Department, the Guam National Guard, Department of Education, the Superior Court of Guam provide 24-hour security at the QFAC. A minimum of 4 officers are assigned to the QFAC. Again, that is a minimum depending on our packs and the needs that arise. 2 are located at the roadway entrance and another in the front of the building, or the other 2 in the front of the building. Security officers at the roadway entrance will screen and clear persons prior to driving onto the grounds of the facility. Officers situated in the front, in front of the building will screen, clear, and record person name entering facility. Unauthorized persons will be asked to leave the facility. Security officers will also accept items that are delivered for the passengers. So they are the first ones who actually meet the family members who are dropping items for their family members. Officers will also ensure items are labeled with the passenger name and room number. And from there, it is our QFAC staff that make those deliveries. When it comes to processing passengers, let's talk about the preparation for incoming flight arrivals. Once a flight arrival time is confirmed by the airport, the QFAC personnel perform general sanitation of the lobby area and transit bay area. A list of available rooms and bed types are printed. Room checks are done to ensure they are cleaned, unlocked, and left open. Power cards are also inserted to every room so that the room is basically ready to be occupied. When the arrival is announced by the QFAC airport team, the information does also include the passenger count, dietary and medical needs, and other notes. Our staff is responsible for getting the luggage carts positioned outside. Meal carts are prepared with meal options available. The buses will then arrive and passengers are instructed to enter and line up for check-in. We do have the entire lobby marked off with the 6 feet separations, and that's a tape on the floor just to ensure safety and social distancing. Rooms are then assigned. Passengers will sit. They'll wait for the briefing of all guidelines, rules. We let them know about the schedule, things that they're allowed to bring in from the outside. And we also allow them to ask some questions and get them the answers that they do need. Then we wait for the luggages. Luggages are transported by the DPW staff. When luggages are loaded outside, QFAC staff bring it inside and line it up for the passengers. Passengers are instructed to get their bags and line up towards the elevator. Meals are handed out to them. Passengers proceed to their assigned floor. Staff are always on the floor to ensure that they enter the correct room. Staff provides assistance with luggages to rooms as needed. Staff also assists with ADA passengers in wheelchairs, making sure that they do get safely transported into their room. After a passenger is secured in the room, the QFAC personnel can be cleared, and because we do ask them to stay until the very last flight, at least for the evening shifts. And then we ask one staff to just stay behind just in case a passenger is not satisfied with their room and we have to make major room changes or constant room changes, which really does happen on the daily. And we're talking about 11 p.m., 12 midnight, 1 in the morning at this time because of how long it takes to clear all the flights. We do meal tags on the doors so that when meals are delivered, it's easily identified how many meals or what their dietary restrictions are. So that has to go up every night before the operations begin the next day. Then the QFAC coordinator will communicate with the lead nurse on any urgent medical evaluations needed. We tend to the expected requests and concerns from passengers, await for administrative updates, and then prepare for the end of day report for distribution, as I indicated earlier in the flow chart. We also have health screenings, as we talked about, and basically the nurses do provide health screenings twice a day. It's typically because they do get their first screening at the airport, they don't get screened when they come. But the next day they will get their temperature checks, and those that are displaying symptoms will be seen more often than others. And those that are not displaying any symptoms are sometimes just would get one temperature check and then a follow-up phone call like in the afternoon, just to ask them how they're feeling and if there's any changes to their health. Let's talk a little bit about COVID-19 testing while in the facility. Passengers with symptoms of potential COVID-19 infection, such as fever, cough, shortness of breath, chills, muscle pain, new loss of taste or smell, vomiting or diarrhea, and or sore throat will be recommended to be tested for coronavirus. A health worker will submit a request from DBHSS and the passenger to be tested, or for the passenger to be tested. If the test result is positive, the passenger will immediately be transferred to the isolation facility to receive appropriate treatment. If the test result is negative, the passenger will remain at the QFAC and complete their 14-day quarantine. The passenger will remain at the QFAC and will continue to be monitored and receive daily health screenings. We offer at the facility counseling services for passengers. Behavioral and mental health workers will provide counseling to passengers experiencing PTSD, stress, depression, anxiety, grief, and other mental health concerns. The lead staff makes recommendation to the medical review team in the event that the quarantine period is not conducive to the mental health needs of the passenger. So we do address this on the daily. So a departure time, or when a passenger completes their 14-day quarantine, just to paint the picture, the departure time is determined by the flight arrival time. As an example, if they came in on a 7 p.m. Hawaii flight, then Hawaii flight arrival will mean a 7 p.m. release time on the 14th day. Release times could be changed according to public health. They'll allow for a 3 to 4 hour period of change just based on the scheduling of any incoming flights. We want to make sure that outgoing passengers are not interacting or being in the lobby at the same time that we do have new incoming passengers. So safety is our priority. Just want to paint the picture. The night before a departure takes place, we do give departure surveys under all the doors of those that are scheduled for release. Then we collect them in the morning and we evaluate whether or not they have reliable transportation home. If they don't, we do make those arrangements with DPW Transport to take them to their residence. Again, they've completed the 14-day at this time. And then we also manage and collect their luggages ahead of time just to allow for a more efficient departure process so that they're not crowding in the lobby and that everything is in order. The departure typically with a 6 p.m. or 7 p.m. departure, passengers are told to just put on their masks. Please practice social distancing. They are told to only enter the elevators one room at a time. And then they proceed to the lobby, for which they are given their discharge papers, which is a clearance of 14-day quarantine from the Department of Public Health. And they basically wait in the lobby for their ride, but most of the time their ride is already there waiting for them. Now, Senators, I just want to point out that there are different programs that are in the QFAC, that exist in the QFAC facility, including what's called an early passenger release, meaning they are not there for all 14 days, but we call it a medical transfer to home quarantine. So passengers that are released under the 14 days is on a case-by-case basis and must be approved by Public Health and Social Services. Reasons for early release, but not limited to, are pre-existing medical conditions, pre-existing mental health conditions. They may be in a fragile state, like the elderly, those that have high-risk pregnancies, pregnancies with complications, etc. We have passengers that have family members that they came back for because they have a terminal illness, meaning they're already in the hospital receiving critical care, or they are officially under hospice care. We have passengers that fly back to Guam because there's a death in their family and they're here to attend the viewing or funeral. And we also have case-by-case identified needs that are not specific to what I just mentioned. But prior to a medical transfer to home quarantine, the home must be suitable for self-quarantine, and passengers must have the resources to have their needs met without leaving their home for the remainder days. So in other words, they may be transferred out for home quarantine, but they are still monitored up to the 14 days as if they were in the facility. So public health does have that responsibility, and the passenger also commits to their end of the responsibility. Then we have early releases of military personnel. We call that the military transfer to base quarantine. If a DoD passenger and or a DoD dependent may be released before completing the 14 days upon receipt of official documentation from the command that represents his or her branch of service. An authorized representative, which is a uniformed personnel, is required to provide transport from the quarantine facility to the designated military home or facility assigned. I'm going to talk about the laundry and linen service. So currently at the Pacific Star, there are no laundry services for personal clothing during their 14-day quarantine. Passengers may hand wash their personal garments in the room. We make these announcements upon their arrival, and we also let them know what has been working for the previous passengers. Sorry, my throat is so dry from talking. So passengers are all provided with clean linen. Sorry, somebody's going to pass me our water. Just give me a second. Thank you. That's better. Sorry about that. So clean linen is provided in every room, including bed sheets, extra towels, and linens will be washed once a week. Passengers must bag their used linens, and thank you. Everybody's so good here. They have to bag it and place it outside their room. Clean linens will be provided to the passenger's room upon request. So passengers can either ask for new linens, but they are required to change the bedding themselves because nobody can enter the room. Okay, so that's an understanding that we announce to all of the passengers. And we also make sure that we manage expectations by, giving them the reality of their stay while they're in the quarantine facility. And again, this is a draft SOP, and senators, the reason it is still in draft form is just because it has never been created prior to this event. And every day something new comes up and it's different, and we are working, it's a work in progress, and we learn more every day, and we are committed to just making sure that the final SOP will contain everything and anything that is needed. Hopefully we never have to go through anything like this again, but we are making sure that this SOP, when it's final, is going to help us move further along in the future if needed. Oh, I'll just also add that currently, just for everybody's information, we do have a pool of staff of 28 personnel. And the shifts do vary for different times of the day, but the most staff that is needed is typically in the evening because that's when we have departures and the incoming flights and the deliveries. And our current PAX at the Pacific Star, we have 256 passengers occupying 185 rooms. Thank you.
Thank you very much, Rebecca. Like I stated earlier, and the introduction for the quarantine facilities and isolation facilities. The question might come up, why the quarantine facilities? And so this, the use of the quarantine facility was, again, an early decision by the administration, by the governor, to immediately begin the containment of COVID-19 cases and the spread here on our island, knowing that our early cases of COVID-19 came from the Philippines. And so again, the quarantine facilities is a tool for us, a mitigation tool. And perhaps the question might come up, well, why don't you increase your testing capacity? At the onset of using the quarantine facilities, we did not have a robust testing capacity. There was a shortage throughout the nation, throughout the world, quite frankly. And so again, this tool was available to us, and so we used it. And so currently, as we continue to increase testing capacity, that is an option for us, and those plans will continue to be reviewed by the Physicians Advisory Group. Additionally, I know Rebecca basically explained the entire process, standard operating procedures, and the information concerning the arrival of passengers all the way up to their stay and release at the quarantine facilities. I am pleased to note and recognize our entire team, because even the Department of Defense has utilized our model for the sailors that arrived on the USS Theodore Roosevelt for their quarantine sites at the facilities that they have designated when they were quarantined in Tumon. So again, our work with the quarantine facilities, our standard operating procedures helped the Department of Defense, and now we essentially have paved the way for some of the control and mitigation efforts in containing COVID-19. If we can proceed to the next slide, at this time I'd like to discuss the COVID-19 budget under the CARES Act, and next slide. Throughout the, Crystal, can you move that screen thing there? To assist the states and the territories, the federal government has directed money in direct aid to Guam under the Coronavirus Aid, Relief, and Economic Securities Act, also known as the CARES Act. And as part of the CARES Act, Guam received $117 million, and the budget for the CARES Act funding, it was really 117.9 to be exact. The budget for the CARES Act funding was developed based on the United States Department of Treasury's guidance for state, territorial, local, and tribal governments that was issued on April 22nd. This budget was submitted to the Guam legislature on May 5th, and I am now pleased to yield the floor to our director of the Department of Budget, Mr. Lester Carlson.
Thank you, sir. I'd like to draw the attention of everybody watching to a submittal that we provided to the Speaker's office yesterday. On May 8th, Senator Kelly Marsh wrote to the governor asking for some information on the development of the CARES Act budget. Specifically, she was talking and wanted information on agencies under her oversight committee and how their needs were addressed. So what we decided to do, because a similar request was made during the Special Economic Service meeting last week by Senator Sabina Perez, for the entirety of the responses from agencies to BBMR's request for costs and future expenditure needs from the different both line agencies as well as executive agencies, to include the judiciary and the legislature. So instead of just being able to address Senator Marsh's question, the governor prepared a response, which went out yesterday, May 13th. And if I guess I'm going to get dry mouth too, so might as well read it. Off a day, Senator Marsh, this is in response to your letter of May 8th seeking clarification for CARES Act funding for oversight agencies. I understand that you would like an explanation of how the $117.9 million received under the CARES Act was allocated and prioritized for essential and non-essential government entities, and the guidelines used in determining the true needs of the agencies concerned. As was noted in my transmittal letter to the Speaker relative to the CARES Act budget, I had directed the Bureau of Budget and Management Research, in coordination with the fiscal management team, to develop a budget for the CARES Act funding. In this regard, BBMR on April 27th had contacted the various executive, line, and semi-autonomous departments and agencies, to include the legislature and the judiciary, for information targeted towards COVID-19 response expenses and recovery needs. Such contact was conducted via email correspondence and a follow-up through telephonic communication with the various points of contact for those departments and agencies and entities previously noted. A copy of the U.S. Department of Treasury's guidance for state, territorial, local, and tribal governments that was issued on April 22nd was also provided as an attachment for the departments and agencies to review and be guided accordingly. As part of this request for information, BBMR emphasized to the departments and agencies that their input must follow the guidelines on eligible expenses, that any COVID-19 expenditures and expenses are for the period from March 14th onward, and specifically that the guidance excluded expenditures for those items already included in its approved fiscal year budget. BBMR also emphasized that departments cannot double dip, whereas only one federal fund source is to be charged in order to eliminate duplicate expenses under the Coronavirus Relief Fund and also for future audit purposes. A deadline of April 29th was given for all agencies' responses to be considered. Again, this was an effort to be able to provide a budget for submission and review, ultimately approval by the governor. So we did have timeframes under which we were requested to put this together. BBMR then compiled and reviewed these responses and separated all eligible costs based on the breakdown outlined in the guidance for non-exclusive examples. Non-exclusive examples of eligible expenditures. In other words, if something came in and it was obviously an ineligible expense, we made the downward adjustment. The development of the CARES Act funding is primarily based on input as provided by the various government entities, whether essential or non-essential. Thus, this includes the budgets for those departments and agencies under your oversight authority. This letter from Governor Leon Guerrero is addressed to Senator Marsh. In an effort to be transparent, the various communications between BBMR and the government entities, including those under your purview related to their COVID-19 expenditures and expenses, are attached as Exhibit A. This is Exhibit A. This was requested again by Senator Sabina Perez. It contains all of my staff's first request for information and any follow-ups, and it also has the agency's responses. So this was submitted as part of a 3-attachment correspondence that went to the Speaker, Senator Marsh, and Senator Augustine yesterday afternoon. In addition, the governor also provided an Exhibit B, which is a listing of all federal stimulus and assistance programs that the government of Guam has received and expects to receive in the coming days. The governor concludes her letter by stating, "It is my hope that I provided you the requested clarification on the formulation of the CARES Act budget. Please be assured that I will continue to provide updated information as it becomes available to the general public relative to COVID-19. Again, this is signed by Governor Leon Guerrero in a letter to Senator Marsh yesterday. I would now like to draw your attention to Exhibit B, noting that this is an evolving process, and we were trying to get the information as succinctly out as possible. But I will note that in yesterday's transmission to the legislature, we did make a transposition error on page 404, item 27, the election commission. The amount should be 600,000 as opposed to 60,000. That will take your estimated amount up by another 540,000. And that results in a cumulative total of 1,320,751,618, with 560,073,381 received by the government of Guam to date. The spreadsheet is broken out, and this is a collaborative and evolving exercise between the Guam State Clearinghouse and BBMR to be able to capture and make available all the funding sources that we are looking at receiving through the current authorization. And there's discussion about another stimulus. As soon as that becomes law and we have greater details, we will certainly provide that to the public and the legislature as well, simultaneously. The breakdown of the spreadsheet in Exhibit B has the department, that is the recipient, the federal grantor, a description of the use of the funding, the estimated amount that is expected to be received. The next column is the actual amount received to date. And then some comments with respect to where things currently are. So the first item as an example was that very early on, the Department of Interior reached out to the governor and said, we have TAP grant money available for you. You don't have to go through the normal application process, just respond to this, and upon receipt of your response, we will earmark what ended up to be $12 million in technical assistance program grant funding for Guam. So you will see that the amount is $12,039,565. We're going to be drawing down that amount. We have to put a plan together as a prerequisite for drawdowns. The first prerequisite was to provide a copy of the pandemic plan to the Department of Interior, and that was done last week. We are in the process of beginning to look at how we're going to apply the $12 million under this TAP grant. It is primarily used for assistance related to response to certain situations, more technical than it is programmatic. So in other words, if you need a recovery plan to be put together, the funding for consultant services will be provided. The result of the consultant services engagement should be a blueprint for how to proceed and should include funding requirements and things of that nature. So that is a traditional use of the TAP grant money. Whereas when you go down the line, you'll see various grants for various programs. And we have a listing here subject to change because the amounts actually are, thankfully, are going up. But we have 28 items under the heading of federal assistance estimates for executive branch departments and agencies. We have another 6 items that are federal assistance estimates for autonomous and semi-autonomous agencies. And again, I'll draw your attention again to page 4. There was a transposition error. So the Election Commission, the amount is $600,000, not $60,000. So in response to the agenda items sent by the speaker, this is a 2-part plan or 2-part response. The first one is dealing with the Government of Guam response plan to combat COVID, which has a category and a topic that I'm touching on now, how the $117.9 million budget was allocated and prioritized. So we've provided that in the governor's response to Senator Marsh. But I'm also jumping, sorry, but on the second page, support received from the Trump administration in response to COVID-19. The speaker has several dollar amounts for different programs. We decided that we would provide a more detailed response, not just to what the speaker had sent along, but more comprehensive, in a true effort to uh, enlighten both the public and the legislature. So there's a lot of information here. It was sent yesterday afternoon. I'm very hopeful that the, uh, the legislature and I understand the Speaker's office also posted this information on their website, that everybody gets a chance to take a look at it, especially the Exhibit B information. It does give a wealth of information on what funding source, where the recipient agency is, and a description of the use of the money. I will be sending an update probably at the conclusion of this informational briefing, as we did actually, as I said, it's an evolving process. We have even more information to provide to Exhibit B. So I'll send an updated Exhibit B at the conclusion of this informational briefing. I'll direct it to the speaker for dissemination accordingly, and I'm sure all this information will end up being on the recovery website and the governor's website for even broader accessibility to the public. I think, sir, that takes care of that.
All right, thank you very much, Lester. As he noted, we did go back and forth on the agenda, the outlined agenda from the speaker. So I think the information, of course, will be readily available to you, the senators, as well as the public. And so if there are any further questions, you may direct those to us. If we can go to the next slide, the update on the Guam pandemic plan. From March 3rd through the 5th, Public Health held a pandemic plan review working session that involved the Department of Public Health Social Services staff and all stakeholders, to include our government of Guam agencies, nonprofit organizations, and community stakeholders. And the working sessions yielded recommendations on how to update the 2008 Guam pandemic plan to meet the current needs of the island. As we all know, Guam entered a state of public health emergency due to the COVID-19 pandemic plan before the plan could be updated and adopted. So Guam is currently using the 2008 Guam pandemic plan. And as we have shared with you throughout the entire process, we have implemented additional standard operating procedures, additional responses to the pandemic. And we continue to compile and record all of this so that this can be part of the process in adopting an updated pandemic plan for our island community. If we can go to the next slide, which is the GovGuam recovery plan, I'd like to bring up the Deputy Administrator for GITA, Dr. Ricky Hernandez, to cover the Government of Guam's recovery plan and the tiered approach to the pandemic conditions of readiness.
Afternoon, Madam Speaker and senators of the committee. So the GovGuam Recovery Plan was released on Thursday, April 30th, 2020, and it was entitled the Chalan Para Hinemla, Guam's Road to Recovery, which outlined the framework for Guam's recovery and gradual reopening of the economy. As you're aware, this plan presented a roadmap to help us navigate through these very uncertain times. As we are all aware, the 2019 coronavirus, also known as COVID-19, has had a detrimental impact not only on Guam's economy, but on the world's economy. This plan was crafted from review of previous reports and studies such as the Opening Up America Again guidelines, but tailored to the unique circumstances that we face here on Guam. More importantly, this plan was crafted with members from both the medical and business communities, which provided varying perspectives that truly informed the final guidelines. As you may agree, the interests of medical experts and business professionals may not always align, but through collaboration and coordination with the Governor's Recovery Panel of Advisors, we found common interest toward gradually reopening the economy. So just as an opening, on the next slide, Madam Speaker, Madam Chair, I know that You had requested the process behind the creation of the tiered PCOR approach. So I'll just discuss the process. The actual guidelines are on the GITA website. You can find it at investguam.com/road to recovery. But I'll just speak to the process of the behind the creation of the PCOR approach. So the process behind the creation of this tiered PCOR approach heavily involved the governor's recovery panel of advisors, which included myself as well as the following individuals: Dr. Mike Cruz, who's a state surgeon; Dr. Thane Hancock, who's a CDC epidemiologist; Christine Baletu, who's the chair of the Guam Chamber of Commerce; Holly Rustick, who is the president of the Guam Women's Chamber of Commerce; David John, who's our GITA board chairman; Joaquin Cook, who's president and CEO of Bank of Guam; Joseph Bradley, our resident economist for basically the island; and Pilar Laguatnia, president of the Guam Visitors Bureau. So this recovery panel of advisors met several times with the governor collectively, as well as others discussed with her individually aspects of the plan as it was being developed toward finalization. The plan was also presented to the governor's physicians advisory group, which is comprised of over a dozen doctors. And the feedback they provided was incorporated into the plan. Ultimately, the plan was adopted via Executive Order 2020-11. It's also probably important for me to reiterate that we would not have been able to get to this point of discussing reopening if it weren't for the diligence of the community and everyone's responsibility to each other to lower the risk of the spread of COVID-19. This plan is first and foremost driven by medical data and public health preparedness. But although this is the case through discussion with the recovery panel of advisors, we wanted to ensure that the movement between PCOR levels was achievable, yet was still sound from a public health perspective. And we believe we have achieved that goal. And so that's basically the process behind the creation of the tiered PCOR approach. The final guidelines was a abbreviated version of a longer internal report that really guided us in terms of how we released the final abbreviated version of that plan. So that's basically how we created this PCOR approach. And just for the next slide, I think I have here is regarding the $20 million small business relief program update. So the governor had identified $20 million of the coronavirus relief funds for grants toward costs associated with business interruption. And so at the Guam Economic Development Authority, we have been in constant discussion on crafting a plan that provides for funds for our grants, basically not loans, but grants to small businesses. So the details of the small business grant program are expected to be released early next week. And it'll be an online application process for small businesses. The intent was to ensure that the application process is as seamless as possible so that we could get these funds out to our small businesses as efficiently as possible. We received requests to prioritize from the business community. There was some requests to prioritize those small businesses that have not received any funds from the Paycheck Protection Program, as well as the Economic Injury Disaster Loan Program grants, or even the loan itself. This was a large consideration that we had in crafting the plan, and we expect to ensure that we prioritize these small businesses that need the help, but also will not close the door to those that have received such assistance. So we're working on that tiered approach to ensure that we do have priority on those that really need the funds, but we are not closing the door to those that receive PPP loans or EIDL loans or grants. The guidelines related to the coronavirus relief funds allows for the provision of grants to small businesses to reimburse the costs of business interruption. So the plan that we'll be that I believe the governor will be announcing next week will ensure that we are identifying this definition of business interruption, as well as providing these direct grants based on, I think it's based on size of business. So we are currently working out the process of putting it online, which we expect to have available sometime next early. And we're going to be pushing it to be online so that those that may not be able to come in, or in terms of social distancing, we want to make sure that we've encouraged that more than just coming in and submitting an application. So that's that's really what we have for small business. I think it's also important to note that the 20 million is nearly is about 17% of the entire 117.9 million of the coronavirus relief funds, of which another 20 million was also provided for individual cash assistance. So we're looking at 35% of the entire coronavirus relief funds as non-governmental costs, as opposed to actually putting money back out into the community. And I think if that was compared to other jurisdictions that receive the same funds, obviously larger amounts for different jurisdictions, I think 35% could probably rival a lot of the other jurisdictions that did receive these funds. And I think the last one is related to the GITA economic impact study. So in the budget that was provided to BBMAR as it relates to the coronavirus relief funds, in that budget included what was considered an economic impact. I don't believe the word study was included in there. But currently we have an economic analyst that's on contract that was extended. And the intent of that was to ensure that we utilize our current contract with him to analyze the impacts of the COVID-19 on Guam's economy. So that's essentially the scope of work. We have an existing contract, and what we're doing is we're utilizing that existing contract to assist us in reviewing these economic impacts. So I hope that I think that ends at least my part. Thank you, Madam Speaker.
Thank you very much, Dr. Hernandez. At this time, I'd like to ask Lester to come back up just to cover the response to revenue reductions.
Thank you, sir. As I stated last week during the Special Economic Service meeting, we are incorporating the impact of the federal stimulus on our island, looking at the application of the funding both in 2020 and 2021, fiscal years 2020 and 2021. We are taking steps to mitigate non-essential expenditures in the government of Guam and the line agencies. And we understand from the last consolidated revenue and expense report what our general fund shortfall is projected to be. That shortfall actually only took into account not even 30% of the federal stimulus injection to Guam. So there's going to be an economic impact on island with the receipt of additional fundings for different programs. And we understand we're going to have a tourist attraction fund reduction that's already articulated and projected in the special fund report that was provided to the legislature and made public. So the bottom line is for fiscal 2020, I'm again cautiously optimistic about how the federal stimulus money will help to mitigate some of our overall shortfalls, both in the general fund and special funds. And as you can go through the list in Exhibit B, I'm hoping that you'll understand why I have that optimism. With respect to 2021, I maintain the position that it's too early to tell what 2021 is going to bring. If there's no meaningful resumption of tourism, then we really can't begin to adopt revenue levels that have some tourism direct and indirect impact. So until there is some idea of how that main pillar of our economy is going to restart, I don't believe that is something that we can proffer with any certainty. I am fully supportive of the legislative process with respect to looking at the governor's executive budget request, her proposal for spending in 2021. overlaying that with some OFB work on where they believe revenues may be, and then the legislature doing the traditional public hearings on revenue discussions, revenue adoption, and then from there, allocating projected revenues accordingly for the development of fiscal 2021 budget. We don't believe that those discussions should take place immediately, given the evolving information on federal funds, given the uncertainty on the resumption of tourism. We do have to begin talking about it, but I can't even begin to point to or feel comfortable about what anything in those sectors would yield to us. So we're status quo on 2020, and we believe that it's incumbent on all of us to take a step back and not be rash with 2021. There's a lot we don't know, and until we get some certainty, I believe the process should just take its normal course. Thank you.
Thank you, Director Carlson. At this time, moving on the outlined, I'd like to call up the Director of Administration, Director Ed Byrne, to cover the $736,000 in CARES Act funding that was awarded to the Guam Department of Administration.
Madam Speaker, Senators, sadly for the DOA, actually that $736,000 wasn't awarded to the Department of Administration. When federal monies come, effectively they all come through the Department of Administration, and some of those funds are pass-through funds, and this is one of those. This money came from HRSA, which is the federal agency of Health and Human Services that supports the community health centers. So this money will actually flow through to the community health center to support the important work they're doing in serving the patients that they have to service during this pandemic.
All right, thank you, Ed. At this time, our next slide is federal support, and I'd like to call up the Director of the Guam State Clearinghouse, Ms. Stephanie Flores, to provide an overview of the federal funds.
Good morning, Madam Speaker, members of the 35th Guam Legislature, members of the media who are listening, and most importantly, members of the Guam community who are also tuning in to get this much needed information. As was stated, I am Stephanie Flores. I'm the Director of the Guam State Clearinghouse. My office has the responsibility of overseeing federal funds that come through the government of Guam through the different various government agencies. The money that is coming in through the CARES Act and other sources are coming through the government of Guam as a grant in aid to the government of Guam. As a result of that being a grant from the federal government provides us with guidance and requirements as to how these funds will be spent or can be spent. And in exchange for these funds, we have to provide reporting either quarterly, monthly, or semi-annually. And each separate fund source has those separate requirements. And each individual state authorized agency is responsible for providing that information back to the federal government. Included in those reports list out what the funds are used for, when they are used, and the manner in which they are procured, the supplies or other things are procured. Specifically, you had questions about USDA funding, the $3 billion that was referred to from USDA to purchase fresh produce, dairy, and meat products. This was to include the community of Guam. The state distributor for Guam for our USDA is the Guam Department of Education. And these $3 billion funds was not for Guam specifically, but for the entire nation. And normally these would have been distributed in much the same way as the commodities that the Guam Department of Education distributes to families on Guam. You know, you've seen the cheese and the milk and the peanut butter that is distributed routinely. This is the same type of program. USDA is also working on a program to assist our farmers and ranchers on Guam directly. And it is my understanding that the local USDA office is undergoing training right now for that program so that they can begin rolling out that assistance for our local farmers. You had questions about the USVA funds, and a part of those funds are the $1,200 economic impact payments that are provided for them under the CARES Act. And what the USVA and the Treasury have done is, and I'm sure Daphne can speak to that more than I can, is to ensure that those of our veterans who are on veterans assistance receiving federal benefits will also receive the $1,200 impact payments. Additionally, the relief provided for through USDA is relief directly to veterans, meaning this money is not going to come through the government of Guam. It is to help them offset pre-existing debts that they might have with the USVA, or it will suspend collection efforts related to those debts that veterans might have. The U.S. Department of Transportation has provided $2.7 million in funding for the GRTA, and that we received a notice of award on that amount, and the GRTA is working on that award right now. We did receive an additional $2.9 million in funding from the United States Department of Justice through the Edward Burns Memorial Justice Grant. This was some money that went through the Bureau of Statistics and Plans, who is our state authorized agency for the United States Department of Justice. This funding went to assist our law enforcement community to provide them with the necessary supplies and equipment to respond to COVID-19 situation. As you can see on the slide, which outlines our federal support, which is the next slide to this one, you will see that this is the snapshot of the money that is being received, and you'll see the granting agency and the agency that received it. Now, you would notice that a bulk of this money is going through the Department of Public Health, because the type of situation that we're in is a health crisis. So naturally, a majority of the funding will go to Department of Public Health and Social Service from the United States Department of Health and Social Services. The other large chunk of money that you see here is through the PUA and the FPUC program, which is the Pandemic Unemployment Assistance and the Federal Pandemic Unemployment Compensation Program, which Dave De La Sola from the Department of Labor has done a fantastic job of explaining to you over the last several weeks where we are on that program. You'll notice that the budgeted request amount is over $900 million, and the first installment of that has been approved at $276 million plus. So those are well underway. So I will assure you that all of these funds that you see on this slide have federal requirements for reporting, and that each agency you see here listed is responsible for reporting to their grantor agency. And under the Guam statute, those reporting requirements have to be given to my office as well. So we get a copy of everything that they submit. And this is not just for COVID-related grants. This is for all federal grants that they receive on a yearly basis. It includes formulary grants, and it includes competitive grants. So as Mr. Carlson related to earlier, we have worked very closely with the DBMR to make sure that we're capturing as much of the information as possible out there, to include information related to grants that are being given to nonprofit organizations on Guam. You'll see that Sanctuary has received some funding. You'll see that Guam Legal Services has received some funding. We also captured information on Department of Education and Guam Memorial Hospital, and our autonomous and semi-autonomous agencies. Now, those agencies that are autonomous, semi-autonomous, and the nonprofit organizations also have reporting requirements. And their reports also come to the Guam State Clearinghouse as the central repository for those information. Now, also, in addition to regular grant reporting that we have, and then the grant reporting that we have for the CARES Act, the clearinghouse also has an obligation under the law to review all federal grants and aid related to any disaster. And so that's something that we've done in the past, and it's something we'll continue to do through this pandemic and in the future. So I do note that Mr. Carlson provided a significant amount of information to the legislature about the different funding sources and how it's being spent. So I will end here with subject to your questions that will be provided later.
Thank you once again, Stephanie Flores from our State Clearinghouse. At this time, I'd like to proceed to the next slide, which is an update on the economic impact payment. And I yield to our Director of the Department of Revenue and Taxation, Director Daphne Shimizu.
And thank you, Madam Speaker and members of the Committee of Public Accountability, Human Resources, and the Guam Buildup of the and other members of the 35th Guam Legislature who may be present for the opportunity to provide a summary on the Economic Impact Payment Program for Guam. For the record, I'm Daphne Shimizu, and I'm the Director of the Department of Revenue and Taxation. The EIP program, also called the 2020 Recovery Rebate for Individuals, was authorized by the CARES Act, which was signed into law by President Donald J. Trump on March 27, 2020. The EIP program allows for payments to filers of up to $1,200 and up to $2,400 for eligible individuals and joint filers, respectively, and $500 for each eligible child. Guam Drt is the agency responsible for administering and providing guidance on the EIP program for Guam. Guam Drt is the agency responsible for ensuring that payments are made to all eligible Guam residents, including our veterans, disability, and Social Security recipients. In the last week, Guam Drt received notice that its EIP implementation plan was approved by the Internal Revenue Service and the U.S. Treasury. By the morning of May 6, our Department of Administration confirmed that $107.8 million of the $134.8 million, which was approved for the program, had been received into the government of Guam's EIP bank account. On Sunday and Monday, May 10th and May 11th, 2020, DRT processed payments totaling approximately $75.9 million. DRT will continue to process these large batches of payments for EIP for Guam residents based on the data it has in its systems, and will continue to process EIP program payments for eligible filers as returns are filed. The EIP payments are authorized to be made by Guam Drt through December 31, 2020. We're thankful to our President, President Donald J. Trump, the U.S. Secretary of the Treasury, Secretary Stephen T. Mnuchin, IRS Commissioner Charles P. Rettig, and the teams of the U.S. Treasury and the IRS for the support provided to our people as we work to get the Guam EIP program stood up. Undangkalu na siduas masi to you as well, Madam Speaker, and to the members of the 35th Guam Legislature for your continued support. Siduas masi.
Thank you, Director Shimizu. Online in the conference is our Director of the Department of Labor, Director Dave De La Sola. And so if I can yield to him just to provide us, I know that he was able to present to the Guam Legislature already, but if he can provide a brief presentation on the current status of the PUA and the FPUC.
Thank you, John. But before I do that, I just want to take the time to thank Daphne and her whole staff for working through Mother's Day to make sure that the facilitating this program moving forward to get to our community, they worked really hard. So I just want to take the extra thank you, because as a mother, she literally sacrificed time away from her family and her staff. So to all of the directors who assist in one way or another. Please proceed.
Thank you, Speaker, for the invitation, and I'd like to say thank you for all the senators. It was only been Monday when you got a full briefing from us, so I'll just kind of fly through some of the little bit of quick updates. as today, we had a total of 879 employers that have gone into our Higher Guam module site, employer site, and they have put in 16,198 employee actions. So that continues to grow every day, and we continue to verify these employers, and we continue to monitor that module. Every day since the day that you've seen us, we've been in training and working software with the vendor in the States. We continue to go through each piece of the online application module and vet out those that are not needed and those that are needed, and trying to develop help boxes. This is an ongoing process that we will continue to do until we launch this online application. And as I mentioned on Monday, this is the most crucial piece of the whole pie, because the whole PUA and FPUC will be done online. And I need to try to get this module as clean as possible to meet the demands of the application process. So we just finished a 3-day work session this morning. And along with those, we continue to work with USDOL. Tomorrow, we have another training session with USDOL. And when I say training, it's not only me and my staff, but some of the people that have been detailed to us from other line agencies and autonomous agencies. So this is a huge undertaking that we have multiple Zoom sites that stand in and sit in on these conversations. And I also earlier that morning have a private meeting with USDOL to go through some of these eligibility questions that we continue to develop and work through. And this is a learning process for not only us, but for USDOL. And they constantly, through the questions through the states and through the attorneys in USDOL, develop guidelines for us to work through. And just like several days ago, we had that earning disregard that was thrown onto us, which was brand new. And I think that the PSA that we developed out of that has been well played. And I hope that you all had a chance to see that. Besides that, we continue to work through all our procurements to stand this program up. We continue to work with the multiple sites preparations for the processing and calling in. We're working on a handbook. We are continuously creating a pre-application. We continue to work on training the staff that are on here to prepare them to understand what this program is all about and the kind of questions that they may get at the training sites. We are updating the implementation plan, which was accepted by USDOL. It's a living document, and it continues to be updated as we move forward with this program, and different modules and things are put into place that we have to work on. We continue to get the PPE equipment and the implementation of making sure that the centers are all properly are safe, and the distancing, social distancing is put in place. And I work the phones and do the outreach and the media to make sure that everybody knows in this island where we're at, what we're doing, and how we're doing it, to be as transparent as possible. We've replied to 4 FOIAs, and we've gotten them all out, and I think they've all been placed on the AG site. So any information that you like, you can ask me and I'll send it to you, and it's also available. We also continue to start to stand up the DW grant, that 1.5 million, which is changed into an assistance and recovery grant. And we will be getting, I was told by USDOL, additional DW funding for training and education of these DW workers. So that is running parallel. I hope it gave you a quick outline. I didn't get too much into the weeds because we gave you that information on Monday. If MIS is prepared, I'd like to just show you what was just developed today. And as you can see, this is to kind of reinforce the employers that go and get online and register these employees at Hire Guam. It's simple, it's sweet, and it's to the point. And that is being released already in all our Facebook and to the media. Next slide. And here is a simple slide on what employees and self-employed people might need as for preparing themselves for the application. I hope it's easy to understand and gives it a little bit more information. Following these things, I have a video similar to the PSA that we did on the earnings disregard, and to complement these two documents. If you could play that, please. I don't hear anything.
And if you're half a day, as you prepare to apply for the Pandemic Unemployment Assistance or PUA program, the Guam Department of Labor has created this checklist of documents to help. If you are an employee seeking assistance, be sure to have a valid government-issued photo ID, a copy of at least 2 recent check stubs, and if your employer has registered on hireguam.com, a separation letter if available. If you are self-employed or a gig worker, such as farmers, fishermen, artists, and musicians, you will also be required to provide a valid government-issued photo ID and as many of the following documents as possible to verify employment: business license, permit, contracts, invoices, or bona fide certification, a record of bank deposits or receipts, 1099s, customer statements or billings, advertisement for services, or a mayor's verification letter. Do your best to supply us with as many of these documents to strengthen your claim and get your benefit. However, if you are missing a document, submit what you have in getting your claim. For more information on how the Guam Department of Labor can assist you, visit our website at dol.guam.gov.
I just want to say that I have some people that are a team of comms people from various agencies working with us to start to crank out these messages and information so that when the application process begins, of course, we try to answer the most questions that we can. This is a very complicated program and there's a lot of nuances to it, and I'm going to do our best to get them to understand. The application process is a typical federal online process. It will be a little difficult, but we will be starting a major ad campaign to get people, businesses to go online and apply, and once they do that, to reach out to other family members and help them get online. And as I said on Monday, that's the way we're going to get through this and get the money out as quickly as possible, as collectively as an island, reaching out and helping everybody get online and get a good application in. I hope that gives you a quick summary and an update of what we did on Monday. And thank you very much for allowing me to do this again.
Thank you, Dave. I appreciate the participation. In closing, Madam Speaker, I want to thank you for this opportunity to brief your committee and our island community. I think you know that my faith is important to me, just as I know it is to you and the rest of us. Throughout this crisis, I and many of the people working with us called upon that faith regularly. In doing so, I realize that we are all imperfect servants, called upon to do all the good we can, as best as we can, as fast as we can. At times, the path forward wasn't always clear, but our mandate was unwavering. The governor's prime directive was to save lives and lead us to a place where Guam could begin the long, slow road to recovery. That is where we are now. Along the way, we also demonstrated the legendary hospitality of the Chamorro people. Because the governor was willing to make a tough call in uncertain times, thousands of US sailors are fit for duty among the USS Theodore Roosevelt. While that decision seems easy now, ensuring the safeguards would work required effort and unprecedented cooperation. The risks were real, but so too was the governor's moral responsibility to do the right thing, regardless of the criticism. At that time, Teddy Roosevelt himself provided unassailable guidance. It is not the critic who counts, not the man who points out how the strong woman stumbles or where the doer of deeds could have done them better. The credit belongs to the woman who is actually in the arena, whose face is marred by dust and sweat and blood, who strives valiantly, who errs, who comes short again and again, because there is no effort without error and shortcoming, but who does actually strive to do the deeds, who knows great enthusiasms, the great devotions, who spends herself in a worthy cause, who at the best knows in the end of the triumph of high achievement, and who at the worst, if she fails, at least she fails while daring greatly, so that her place shall never be with those cold and timid souls who neither knew victory nor defeat. Madam Speaker and members of Imena 35 na Legislature in Guahan, thank you for the opportunity to present on behalf of the Leon Guerrero Tenorio administration. And with that, I yield back any time available to us.
Situus Masi, John, Chief of Staff, thank you so very much for the presentation with your team. And I will note that for this committee, with all the other information briefings that I've had with the government of Guam directors and others like Joint Region to do presentations to this August body. Again, I will ask my colleagues that if they have any questions to please submit them in writing and send it to our office. And once we've compiled all the questions, I will transmit them to the Chief of Staff and the policy team there to answer any and all questions that have been submitted, and so that we can get a response immediately and again, it will be noted on our website with all the answers and other recommendations as forwarded to us. I also want to share that in the 2.5 hours that we've been here, I know that this briefing was kind of long, but in the efforts of sharing with the community what is happening and what is out there, our colleagues have gotten preliminary reports and financial breakdowns of what the government of Guam has now received from the projected 1.3 billion. We've already got in our coffers over 559 million. And again, as noted by you and your team, that the numbers are going to be changing as we continue to get more resources. And we already know that there's another bill in Congress that should be passed, and hopefully that we can get more economic relief come to our island. It is really important that the community know what we are doing as a government of Guam for our people. And as you said a little bit earlier, sometimes the information doesn't get out fast enough, but we will continue to try. And I just want to extend my undanklu na sitos maasi. With that being said, if you have any closing remarks from my colleagues, I will start first with my vice chair for closing remarks, and then we will adjourn. So I will open the floor for closing remarks. I will start with my vice chair, then work our way through our colleagues. Vice Chair Taitsunu, you are recognized.
Joyce Massey, Madam Speaker, and I want to thank all of the agencies that have been working all along, all of our frontline responders and everybody here who has been working diligently to continue on behalf of the community. And it was really important to have this here today and to get that slideshow. I do have questions, so I look forward to being able to forward them to you and to continue building up this going back and forth of getting information so that it's readily available to us, but the public as well. So just Massey, Madam Speaker.
Thank you. Vice Speaker Nelson, you are recognized.
Thank you, Madam Speaker. I just want to thank everyone as well for the presentation that they provided. It was very thorough. However, I feel that we should have been given the opportunity to ask questions while we are online, and I understand that perhaps there's a time constraint for that. But it's a lot of information, and I have a list of questions here as well, and I want to thank all of those directors that were present to present for us. So this is, it was a very good presentation. It would have been nice if we could have been able to get all of this information maybe like 2 weeks ago, so it would stop a lot of the other scrutiny. But I'm more than happy to see this happen today, and hopefully that there will be an opportunity for us to create a dialogue with this information visible for the people, so that they can hear our questions and they can hear the responses. Thank you, Madam Speaker.
Vice Speaker, next we have the Legislative Secretary, Senator Shelton, you're recognized.
Madam Speaker, I'd also just like to thank everyone who gathered the information and presented today, and everyone who continues to work on all of these issues for us. And I look forward to the continued information being shared, and I will send my questions as well, and look forward to a more open dialogue in the future. Thank you.
Senator Regine Bisco-Lee, are you still on? If not, I will move up. Oversight Chair NOAP, Senator Joseph Augustine, you may proceed.
Thank you, Madam Speaker, and I echo some of the sentiments of my colleagues. Long overdue report. Mr. The Acting Chief of Staff, I'm hoping that any update be provided to the legislature. We are an equal branch of government, and whenever there's a delay, that's an excuse for me of I hate to put it this way, but of hiding or trying to deceive. And I don't want that to be on my mind or any of my colleagues. So I'd ask that we've always extended our hands to find out what's going on, but it takes too long. We even had to pass a bill 333 to get transparency. This is way long overdue. Since the beginning, we should have been part of this. And if the administration feels that we don't need to be, then fine. We'll see you during the budget hearing. Thank you, Madam Speaker.
Thank you, Senator San Augustine. Senator Therese Terlahi, you are recognized at this time.
Thank you, Madam Speaker. I too was not, thank you for the opportunity and for the presentations. I'm glad to get some of this information. I'm glad about all the positive news. I do wish we had an opportunity to question. I realize we're getting information now, a lot of it, kind of to catch up from past actions, but we would like to be informed that, as the decisions are being made, for example, on the new COVID budget, how, changes, some of the agencies didn't even submit requests, so I expect there may be changes to that budget, and I'd like to be part of the discussion on what the priorities are going to be for Guam going forward with all the money that we're going to be getting. For example, are we going to take care of all the uninsured people, make sure that they're accounted for in our health scheme going forward? A lot of them have lost health insurance. We've got, impacts to the hospital and public health that I think we're going to have to account for permanently. So I do hope that it will be a discussion, Madam Speaker, and going forward, so that we can have some impact and some influence on the policy that is really going to be made for the people. Si Diyos masi.
Thank you, Senator Terlahi. Senator Sabina Paris.
Thank you, Madam Speaker. Yeah, I concur with my colleagues in regards to, I'm very appreciative of the efforts the administration has done in taking this bold step forward for transparency. And I do appreciate that and all the hard work that you've done. On the same token, I do have some questions too regarding, how are we going to move forward in ensuring that we're continuing to protect the community? What are the efforts of stockpiling but overall budget for testing, and really how are we preparing, building up the capacity of our nurses and doctors, as we look at the long-term effects. I'm also very concerned about, the procurement of a lot of this money that's coming through the government. I do have further questions regarding that. So I look forward to the dialogue as well. So Diyos masi, and thank you so much.
Senator Paris. Senator Pito Terlahi, consigue muna.
Thank you very much, Madam Speaker. I just want to thank the panel for such an informative information. And I also want to recognize John Cowell for on his closing remarks, because it was an outstanding closing remarks, and probably it reinforces some of the criticism that we are hearing over the media. Thank you very much.
When Pubetsu, Senator Terlahi, Senator Clint Wright-Joe. I will go ahead and proceed with Minority Leader Senator Taitagui, who are recognized. She's not there. Senator Luis Munoz. Senator Mary Torres.
Thank you, Madam Speaker. I just want to also comment that this was very informative, but I thought John Jr. Calvo, your closing really brought home the sentiment that we need to focus on right now. And I just want to end my remarks by quoting from Herbert Hoover, one of my most favorite quotes in times like these. The quote goes, "Honest differences of views and honest debate are not disunity. They are the vital process of policy making among free men." And indeed, this time has demonstrated that with all the anxiety and with all the stress, there's been a lot of rage and distrust. But I think that the back and forth is truly what we have to focus on. And, thank you, John Jr., also for a very heartfelt closing. I think we need to focus on how all of us are not infallible, but together we can get through these challenges. So si Diyos masi for this wonderful briefing today.
You're very welcome, Senator Torres, and my other colleagues left, but so I just want to extend my personal ndaklan si Diyos masi to you, John, and to all the directors present today. But more importantly, as you hear the sentiments of our colleagues, knowing that continued dialogue is very important, it's very critical because of the information that needs to get out to our community. I think that this is a very positive way of sharing communications, so that when these briefings are out, that our people know that a lot of work is being done, a lot of things need to get done, and are being done behind being done behind the scenes. And a lot of times those unsung heroes are not being acknowledged for all the hard work that they're doing. And I just want to say it is through venues like this that we can continue to share with the community, to share with the media, to just share with all the stakeholders, all of us here on Guam, that this is really important, so that we know that as we continue to go through this ordeal, that we're doing it together, and sooner, we hope that sooner we will overcome this pandemic, and that we will soon have the cure that is needed for us to get out to some kind of normalcy, and so that we can run our everyday lives. And I just know that we need to move forward, and we need to move forward together. So thank you for your closing, but more importantly, thank you for all of us coming together for our people of Guam. With that being said, I will call this informational briefing adjourned at 11:24 a.m. And I ask everybody to continue to be safe out there, and God bless each and every one of you. Sainamasi. Si Diyosan binidisi ang todos. Thank you.